I'm Rebecca Burns. I'm with UCB. I'm going to share a little bit about an ongoing clinical study that we have at UCB for prolonged seizures called the Stand Together Against Prolonged Seizures study. We are searching for people who experience prolonged seizures, those that last more than 3 minutes to be specific, and we're testing an inhaler that can be used to potentially stop a prolonged seizure. So today we're going to talk a little bit about clinical research and then about the study itself, and then also about how individuals can take part in the study. So clinical research study, so a little bit of background on that. This is how we assess to see if a product is safe, efficacious, and whether or not it works in the patient population that is intended. So in this case, what we're looking at is patients who have prolonged seizures, like I said. And so the study is testing to see whether or not the medication is efficacious and effective in stopping a seizure that lasts more than 3 minutes. So there's 4 different phases in a clinical study. So in each of these phases, a different question is asked. So in the first part of the testing of the drug, we're looking at, is it safe? So can it be safely used in individuals? Does it have any side effects that we should be worried about? And then as it progresses through the clinical study process, we're then looking to determine whether or not it actually works. So in this case, the STARS study is in the phase 3 study. The phase 3 study is the very last stop in the drug approval process. So after the drug finishes the phase 3 study, the data is then compiled and then sent to the FDA to determine whether or not it can be used in patients in the general clinical setting. So clinical studies can happen all over the place. They can happen in the hospital setting, they can happen in the clinic setting, they can happen in the outpatient setting, they can happen in inpatient setting. In this case, it's actually a study that's being conducted in the outpatient setting. So it's a medication being tested for those experiencing prolonged seizures in their normal daily life. So just as they're going about their daily life, if they experience a prolonged seizure, they can then use the medication. So let's talk a little bit about the study itself. So the STARS study, the Stand Against Prolonged Seizures study, is, like I said, testing an inhaler that contains an investigational drug that may be able to help people who experience prolonged seizures. So we're testing 2 different versions of this inhaler. The inhaler is about the size of a deck of cards and can be carried with an individual wherever they go. And there's 2 versions of it for the study. One contains the active drug, and the other contains a placebo or an inactive device. So one has the active drug, one is an inactive device without any medication in it. So these devices look the same, and the reason there are 2 different part arms to this study, one with an active drug and one with an inactive drug, is to make sure the active drug does what we intend it to do. So this is how we essentially conduct the study to make sure that the active drug can stop the seizure. So during the study, there's 3 different phases. The first part is a screening phase that lasts about 6 weeks. And in this time period, individuals will go to the clinic site a couple of times for different tests to check in to see if they're a good candidate for the study. During the second phase, the 12 weeks phase, this is when those individuals that qualify to be in the study will undergo treatment. During that 12-week period, individuals are able to use the inhaler to treat one prolonged seizure. Now, an important part of this study is that the individual who is going to be testing the drug must have someone, an adult, who can be with them during the seizure to take certain measurements as the seizure starts and then when it stops. So after that 12-week long period, the final period is the follow-up period. So if the inhaler was used during that 12-week period is then returned, and if it wasn't used, so if the person did not experience a prolonged seizure during that time period, they would then return everything to the study site as the end of that study. So like I mentioned before, there are 2 different options that people may receive during this study. One is a placebo and one is an active drug. So there's a 50-50 chance for individuals on whether or not they would receive the placebo or whether or not they would receive the active drug. Now, for every person, that may make some people say, oh gosh, so I could end up with an inactive medication that's being tested. So during the development of, when a person goes in for these visits, they will sit down with the physician and discuss what is the plan for them, individualized for them, when they experience a prolonged seizure. And in that way, there will always be something built into their plan that makes sure that they don't experience a really severe emergency where they don't have the right medication in order to stop the seizure. So at the end of the study, there is the option for anyone who has participated in the STAR study to then roll into another study that is a long-term extension study. This long-term extension study is testing this medication over a period of 4 years. So there is an option to remain in the study for a longer period of time. So in order to participate in the study, there are several different tests that happen. There are blood tests that happen throughout the study. There's a physical exam that happens as part of the study as well. An electrocardiogram that tests essentially to make sure the cardiovascular system and the heart is working normally. Vital signs are collected throughout the study. And throughout the study, individuals are asked to collect seizure information using an electronic seizure diary. There are also several questionnaires that participants and their caregivers will fill in throughout the study to help essentially check in with the patient throughout the entire time period. So there will be about 250 participants in this study that occurs over 19 weeks. Again, it's an inhaled method of delivering medication, and we have about 14 countries participating in this study. So taking part in this study, so if all of this sounds interesting, and you might be wondering, is this something that I can participate in? So the basic qualifications for participation in this study includes being 12 years of age or older, having focal or generalized epilepsy or a combination of the two, having 2 prolonged seizures that have occurred within the last 3 months. And remember, a prolonged seizure is defined as being anything longer than 3 minutes. And like I mentioned, you have to have an adult partner to be able to help during the study. Excuse me. Apparently Dr. Holder's cough stayed up here. And I'm just going to keep it with me too. So there are other criteria also, but this is kind of the basics of it. So if this looks interesting to you and you want to find out more, you can go to our website, which is starsepilepsystudy.com. We also have brochures, excuse me, up here. And you can go to the website and find your nearest study site. Sorry. You also, if this isn't you, but you might know someone, you can also share this with a friend on the website as well. Sorry. Or you can come visit us at the booth. Thank you. Who knew I'd get so choked up? Please come visit us if you have additional questions. I can take them now, or you can come visit us. There's a whole group of us here for UCB. You'll find us towards the beginning of the front of the exposition hall. We would love to talk to you about it or answer any additional questions, if I can talk. If not, I'll use sign language.
What made you guys decide to do like placebo versus the actual drug versus just comparing it to an already established like rescue medication, especially given like kind of what we know about seizures being harder to treat the longer you study?
It's a great question. So the question was, why wasn't it compared to an existing rescue medication treatment? Because as you rightly said, as a seizure, once a seizure starts, as it progresses, it gets harder and harder to stop as it progresses. So yeah, it's a great question. So the existing rescue medications have been tested and proven to be effective in treating seizure clusters. So to treat the next seizure in a cluster, this medication is being tested to treat prolonged seizures and is intended to be delivered immediately after the seizure begins. So it actually is being assessed for a completely different indication versus the existing medications approved for rescue and treatment, seizure clusters.
So it's not a 3-minute mark here. That 3 minute that you're listing there is just have you had seizures that are lasting more than 3 minutes.
Exactly.
But the instructions for use will be given right at seizure onset.
That's correct. All right, hearing none. Please feel free to grab a brochure at the front of the room if you have additional questions. Grab one of us out in the exhibit hall or check out our website and we'd be happy to address any additional questions that you might have.